The Oregon State Senate heard testimony today on a bill that would ban the distribution of needles near schools and child care facilities. Fox 12 have been following this issue in Portland for more than a year. Investigative reporter Adrian Thomas joins us with the latest update.
Oregon's Senate Committee on Childhood and Behavioral Health just held a public hearing for Senate Bill 1573. It would ban the distribution of needles within 2,000 feet of schools and licensed child care facilities. The bill has bipartisan support, but some still have concerns about how this might impact harm reduction efforts. Fox 12 began investigating this issue back in 2024 when we learned about a program that was offering clean needles and pipes free of charge in one Northwest Portland neighborhood. The purpose was to prevent the spread of disease amongst drug users. But residents in that neighborhood told us they had massive concerns because the distribution was operating in a school zone, where they say kids would have to navigate around discarded needles and drug users on their way to school. We also spoke to Michelle Milla, a Northwest Portland resident who lived right across the street from the distribution. She and others in the neighborhood have played a role in getting state lawmakers to listen.
When we're talking about harm reduction, when we're talking about protections around children in schools, then we need people working from both sides of that proverbial aisle.
When Fox 12's Pete Ferryman initially interviewed Milla, she and others in the neighborhood shared concerning video with us showing people passed out, drug dealers making transactions, and even families having to walk around people using on the sidewalk. Following our coverage, that needle distribution program in Northwest Portland did move to another area. And while Milla says her area has improved immensely, more oversight is needed on these kinds of organizations for the safety of all those involved.
They're not operating as one-for-one exchanges. They are operating as distributions. And with that, comes accountability. We're not against harm reduction. We care for our communities.
At Thursday's hearing with state lawmakers, opponents of the bill said this kind of legislation discourages harm reduction services from operating and will lead to health issues from those struggling with substance abuse.
The logical result of a buffer zone that is this large is that it will significantly reduce access to harm reduction services. So we will see increases in disease transmission. Evidence shows that comprehensive syringe service programs, or SSPs, reduce HIV and hepatitis C transmission without increasing drug use or crime.
Now, Oregon is currently in a short legislative session, meaning lawmakers have only about a month to make any amendments to this bill and hold a vote. Reporting in studio, Adrian Thomas, Fox 12 Oregon.